Revolution of common sense.
Revolution of common sense.
A revolution of common sense.
Truth was once common sense, but today, truth is uncommon. Explore biblical truths around faith, business, and politics with Peter Demas. Uncommon sense in current times.
Hey folks, welcome to Uncommon Sense in Current Times. Don't know if y'all are aware of how bad the statistics are on this, but in 2023, there was over 1,037,000 abortions in America alone, and Planned Parenthood killed nearly 393,000 of those babies. So we can see that Planned Parenthood is clearly an evil organization to be able to kill that many in 1 year. But yet at the same time, in that same year, they received almost $700 million of taxpayer money. And so I'm excited today to talk with Dr. Ingrid Skop. She has been described by ABC News as the public face of the pro-life movement. She's the vice president and director of medical affairs at the Charlotte Lozier Institute, practicing OBGYN for over 30 years. So she brings firsthand experience to her research on abortion's real-world effects, especially tied to the abortion pill. She regularly testifies before state and federal lawmakers, pushing back on it. She's recently written an article in the Daily Wire in the opinion section called "Gaslighting Women. It's Time to Look at Past Planned Parenthood's Slick Marketing." So, Doctor, thank you so much for being on the show. I appreciate you being here.
Thanks, Peter. It's great to be with you today.
So, in that article that we're talking about, the Daily Wire column you wrote, you said that basically Planned Parenthood marketing has successfully gaslit Americans, convincing them that desperate women would have no health care options without Planned Parenthood, and this is untrue. Can you explain that? Can you kind of talk about why that's untrue?
Yeah, absolutely. This organization has some of the slickest marketing I've ever seen, because even Americans who consider themselves pro-life often say that they do support Planned Parenthood because they feel that maybe abortion is just a small part of their services and that they are providing services that poor women need. But the reality is far from that. You mentioned, of course, that they got $700 million in taxpayer funding following the reversal of Roe v. Wade. In that next year, they had almost $1 billion in private donations. They took in $2 billion that year. And yet what we see is that much of that money went out for political reasons, to buy politicians, to sue to overturn state laws, and really just to, as I mentioned in that article, to gaslight the American public. Importantly, there was a New York Times article published in February of this year. Now, normally mainstream media like the New York Times will run cover for Planned Parenthood and other abortion providers. But strangely, this one did not. This one showed a glimpse behind the curtain of just how evil this organization has become. It talked about high staff turnover, untrained staff, moldy equipment, sewage on the floor, women having really horrible complications, incomplete abortions resulting in live-born children who then subsequently died. And this is not the exception, what they described. In my experience, this has become the rule for Planned Parenthood. And I can speak to this from personal experience. When I was a resident over 30 years ago, I moonlighted at Planned Parenthood. I was pro-life then, and I'm pro-life now. And I would say that most obstetricians don't do abortions. But at that time, their mission was more geared toward just helping women with their healthcare needs. But what we've seen in 30 years is that those healthcare needs that we all think women should have access to, PAPs, et cetera, they have gone down dramatically. In fact, they do only about 10% of the number of PAPs today that they did 30 years ago. Prenatal care, barely any. Referrals for adoption, barely any. If you look at their annual report, you actually discover year after year, 97% of their pregnancy services are abortion. Every year, they're providing more and more abortions. Again, 30 years ago, they were doing about 11% of the abortions in this country. Today, it's 40%. And also, it gets even worse. More than half of their facilities do not do a surgical abortion. They will only provide abortion drugs. And we can talk about that because these are much more dangerous for women. They're a very poor experience. And if the woman has a complication, needs to have surgery to complete the abortion, they don't have the ability to help her because they only provide medication abortions.
So I'm it's interesting because in my much more liberal years and before I found Christ, I dated a girl who did volunteer work at Planned Parenthood. I worked at events that where we each had tables, and I remember a lot of that stuff. So when I hear things such as providing medical care, et cetera, so I was like, well, I want to kind of just a little bit get a little prepared, and I wanted to look at, and so I went to their website, and the front page of their website is, book an appointment, STD testing, birth control, abortion, and more. And then it's need an abortion. Do you want to talk to someone about your medication abortion? Then again, it goes down to 4 topics: STDs, birth control, abortion, and then the morning after pill. Everything seems to be about. And then there is the, learn and that it's okay on sexual health, and all the pictures they show happen to be members of the LGBT community. So it's fascinating that I hear this, but I go to their website and I don't see it. So yet they tell everybody outside of it, but this is just a cursory glance. How do you think they're getting away with it? Because you talk to anyone out there who believes that, they really believe it. But again, it didn't take me long to find this. I literally went to the front page of their website.
Yeah, and again, very, very slick marketing, and the mainstream media, of course, run cover for them. So really, most Americans, we're honest people and we believe what we're told in many cases. But regarding the idea that this is the only option for underprivileged women, that is absolutely not the case. There are clinics that are called federally qualified health centers. They are also supported by our tax dollars. There are 15 times as many of those as there are Planned Parenthood clinics. Wow. So they're more widely available, and they provide all the services that women need, including prenatal care. Again, if you look at their annual report, Planned Parenthood almost never helps a woman deliver a healthy baby. In almost every case, what they're doing is offering to kill her baby. Poor women qualify for Medicaid health insurance, and most obstetrician gynecologists will take Medicaid health insurance. So not only do women have the option of these federally qualified centers, most of the time they can get their prenatal care with a private obstetrician. So again, there are so many options for women, but I've cared for patients who've literally barely escaped from a Planned Parenthood with their baby's life. They have told me that they may go to Planned Parenthood thinking they're going for options counseling, but Planned Parenthood assumes if they walk through that door that they are set on abortion. It is very, very difficult for those women to leave without an abortion. And again, that's reflected in that 97% statistic of that's what their services are, as abortions.
So now you have the abortion pill, which becomes a lot more complicated because now you have telehealth that goes along with it. You have, and so even those states like my state of Tennessee, there are a lot of states out there who said, no, we're getting rid of it due to the Dobbs decision. But it still becomes relatively simple because of the abortion pill, of being able to access that and get that. what's wrong with the abortion pill outside of the fact that it's killing a baby? What's wrong with it from the mother's perspective?
Oh, it is a horrible experience for the women. So just to back up for a minute so that your listeners understand, it's two drugs actually. Mifepristone blocks progesterone, so it causes that unborn child to die. And then about 24 hours later, a drug called misoprostol is given. That actually induces labor to expel the pregnancy tissue. So women go into labor. They are told that this is natural, that this is safer than Tylenol. And again, they're really pressured into choosing medication abortion. It doesn't benefit the woman, it benefits the abortion industry because I'll tell you, they can't find enough surgeons, they can't find enough obstetricians willing to kill babies. And so they had a staffing problem. That was the motivation behind approving the abortion drugs under President Clinton in the year 2000. But now, in the wake of the Dobbs decision, the motivation is to get these drugs into states like yours, Tennessee, and mine, Texas, and to kill unborn babies in states that are trying to protect life. Unfortunately, the FDA has been complicit. Over and over again, they've taken it. Initially, when they approved it, there were fairly strict safeguards. Over and over again, based on very little data, they have removed safeguards. And if I may say about the data, we have no federal mandatory reporting about anything related to abortion. We don't know the numbers. We don't know the complications. We don't know the deaths. But the FDA would look at abortion industry studies and say, well, look, they told us they sold 600,000 abortions and they only knew about this many complications. All you have to do is open up that study to discover that many times 25%, 30%, 50% of the women were lost to follow-up. Those studies should have never been published. You can't say anything if you're missing half of the women you sold abortions to. But I cover an emergency room. I can tell you what happens. They know they've been lied to when they have a complication because it's not safer than Tylenol. And they don't go back to the abortion provider. They come to the emergency room and I care for them there. That's where they're getting their care. Planned Parenthood doesn't know about it because they're not going back to them. So along those lines about these really unsupervised abortions, using the COVID pandemic as an excuse, the Biden administration,
Right.
FDA removed the requirement that these drugs be given to a woman in person with a doctor. So no pre-abortion testing is necessary. They're not doing ultrasounds to determine gestational age or rule out ectopic pregnancies. They're not doing labs to determine if a woman is Rh negative and might need a RhoGAM shot. They're not verifying who's ordering these drugs and who's taking them. So sex traffickers have abused them, incestuous abusers, coercive men. Stories across our country tell us that many women are having unwanted abortions because these drugs are so widely available. And again, they're in your state, they're in my state, they're harming women, and the states are trying desperately to do what they can to block them. But at the same time, the blue states have passed what they call shield laws. So their abortionists, for example, in New York, mailed drugs into Texas, mailed drugs into Louisiana, harmed women in both of those states. Both of those states are suing that abortionist, and New York is protecting her through their shield laws. So it's really quite chaotic what is going on between the states.
So what were to happen if I were to take, if I thought I was pregnant and I wasn't, and when I say I don't mean me as a male. I haven't gone that far down either. But if a woman thought she was pregnant and really wasn't, or naturally miscarried like in a couple of weeks, and didn't know it, but missed her period, so just assumes that, hey, I'm pregnant, and were to take those pills with it from there. Do you have to prove you're pregnant before you can get those pills? And if so, I didn't think so. And then what happens to them? Like, what would be the impact? Because if you're trying to deliver to induce labor when you don't have a baby, what happens to your body?
Yeah, not only do they not have to prove that they're pregnant, but the abortion industry has been promoting for some time now what they call missed period pills. So telling women, if you miss your period, you don't have to take a pregnancy test, just take these pills and it'll bring on the period. They're doing that so they can provide abortions without women having the emotional distress of knowing that they chose to have an abortion.
Oh my
And
goodness.
even worse, they're now promoting what they call advanced provision pills. So they're telling women, go ahead and get the pills just in case your contraceptive fails, so you'll have it on hand. So I'm a provider of abortion pill reversal, which is actually giving women progesterone when they regret having taken mifepristone. And increasingly, I'm having women call me who've maybe had a fight with their boyfriend or had an emotional moment and have taken mifepristone because they already had it in their medicine cabinet.
Wow.
And then, and of course they regret it and they call me and we provide progesterone and try to save the baby. But the two things are happening at the same time, and you may have seen these numbers. Babies have been saved in pro-life states like ours. There is very good data that births went up and that we are seeing more children born. But at the same time, abortions have gone up.
Right.
And I think that's because of this, because they're just making these drugs so easy that women who maybe they just aren't even careful with contraception because they think, well, I can just use the missed period pill, right?
Right.
And so that is happening. But in answer to your question about what happens to a woman who takes the drugs if she's not pregnant, probably it'll just bring on her period. But these drugs aren't totally benign. They can increase the risk of infection. They lower a woman's immunity, and they can make her bleed heavily. So there's certainly much easier ways to bring on a period if a woman misses a period than taking these drugs.
One of the things you hear frequently is creating a rape and incest exception, which I think logically doesn't make a whole lot of sense. But what's interesting to me is listening to what you were saying is that now it seems like this is an extra tool that a rapist has to be able to use in these situations, again, regardless of whether or not they're pregnant or not. It's if I have this available, I don't have to worry about having this problem. And it seems like it would increase more danger to women outside of medically than it would otherwise, at least from their security standpoint. Do you agree
Yes,
with that?
absolutely. There are abused women whose abusers are giving them these pills. This has been documented. Anyone who spends time flying, and I fly a lot, in the airport, they always have signs about human trafficking. Keep an eye out, look for women. Here's the warning signs. I'll tell you, statistics tell us the most likely place a woman is going to be identified who's being trafficked is in a doctor's office. And trafficked women, the most frequent office that they go to is Planned Parenthood. So these abusers, of course, now they can get these drugs, and so they're not even darkening the door of a Planned Parenthood. But for decades, it's been documented women go into Planned Parenthood, they don't ask questions, they're back 3 months later for another abortion with a man who won't leave them alone, right? And Planned Parenthood has enabled and abetted human trafficking because they sell abortions. They'll sell 7, 12 abortions to the same woman, and they'll never ask the question, what is going on that you keep coming back? So again, it's horrible for women on such a level, but if we care about rape, incest, abuse, trafficking, then we should recognize that having these drugs so readily available is only going to worsen the problem. But of course, we've seen since the Dobbs decision that abortion advocates act like they care about it.
Right.
We hear so much discussion on what about the poor woman who's been raped, or, what about the woman, life of the mother, these type of things. Those are a minuscule portion of the abortions in our country. 0.3% are abortions that are obtained for rape, 0.4% that are performed to protect the life of the mother. But they're pointing at those so they can keep them available in every circumstance.
So I want to kind of switch a little bit on you here because and talk about the pro-life movement in a way. Do you think that the pro-life movement has conceded moral ground by just framing the message in terms of reduction of abortion instead of sexual purity, instead of, hey, you know what, if you don't have it, but it seems like our fight has been with abortion by saying, look, everyone agrees you're going to have sex, so let's just fight the abortion side of it. Do you think do you think that has been a failure of it, or do you think we've conceded moral ground in that area?
Well, I don't think that most people who are pro-life had conceded that moral ground. We recognize there's a very broad conversation to be had. And the reason that so many women are at risk for abortion, 87% of abortions are in unmarried women, right? So we recognize that the promiscuous sexuality that our country, this road that we've been traveling down for years, has led us to this place. And it goes all the way back to the 60s when contraception was promoted, because that's when we really just saw a jump in promiscuous sexual activity outside of a relationship, outside of marriage. And many people in the pro-life movement are talking about it. But, honestly, when the house is on fire, you say, I got to save my children first, and then I'm going to save
Right.
my pets. And then maybe if I have time, I'll go back. So I think that we recognize with a peak of 1.5 million abortions back in the 90s, 65 million abortions in the past 50 years. These are human lives. There is no scientific denying it. And women they know they're ending the life of their child. They're in these circumstances where they think, this is my only choice. I don't, they're embarrassed or financially they have problems, or their relationships in problem, and they think this is the only choice I have. And so sadly, our country has just promoted this horrible option, ending your own child's life to women, instead of doing the hard work to address what their real problems are, the financial, the social, things like that. But we care for the babies, but we care for the moms. And so many moms have been emotionally hurt. They've had mental health complications. That data is quite compelling. I've cared for so many women 20, 30 years after the fact, in tears in my office, recalling an abortion that they've had. And in fact, Lozier just published a study not too long ago that documented that 60% of women with a history of abortion said they'd have preferred to give birth if they'd only had more support, financial, material. The good news is there's 3,000 pregnancy centers in our country doing that. They're providing the support. So really it's a broad, the pro-life community obviously is very disparate. You can't really narrow it down to just one thought, but there are so many people who are really trying to say, it's not just the baby, it's the woman. We want to help them both, and they are helping them both.
I recognize that a lot of shift and changes has taken place, from the throughout years on both sides of this debate, and when I watch how and again how Planned Parenthood now just seems to frame it in the way your article, I think you say it really good, and but by basically gaslighting everybody, saying this is what we're here for, and in reality is that's not what they're there for. However, and it does seem like that again, the pro-life movement is constantly chasing, where Planned Parenthood before was like, it's a stigma to get pregnant, and we're trying to help those women who get pregnant and can't afford to have another child, and we're trying to do this stuff. But there was all this stuff, and now they're like, we don't really care anymore. We just want to kill babies, but we're going to really say it's women's health and women's rights to be able to terminate it. They really switched it, and I think even moving from health to rights is part of it. Pro-life seems to be always chasing that. Do you agree with my assessment on that? That just seems to be my observation from outside of it looking in.
Yeah, I think you are right. There's so few of us that are really vocal, and again, their side of the movement has all the mainstream media trumpeting their talking points. So it's really overwhelming to the average American. And I think part of it is that it's so uncomfortable to think about. Even Christians in the church, they may say, I recognize the Bible says man is made in God's image. that he created us in the womb, that he, that children are a blessing, not a curse to God. And yet at the same time, like you said, they think, well, I just don't know the circumstances women are in. So, and besides it's political and I don't like to think about it, so I'm just going to back away. And so we've got that on the one hand, good-hearted people who just don't really want to think about it, don't really want to look into it. We have Google who's not pro-life. Even if they wanted to do a search to find out what's really going on, it's going to direct them to Planned Parenthood and Guttmacher. And, so they're not really going to find out what's really happening. Yeah, I wish that we could talk about it more. I wish it wasn't such a divisive issue, but I think the division is part of it. And those of us who do speak out about it, we're attacked. I mean, it's really not very pleasant to be sometimes in my shoes, because there are a lot of people who are trying to destroy me and destroy my career, and that happens too. I mean, we're in such a divisive society that rather than engage in an argument, people would rather just destroy those on the other side, so they don't have to actually come up with any facts to defend their position.
Okay, so in your world, if what would a bold, unapologetic looking pro-life movement look like in the 2025, 2026? And what would it stop doing that you think is just kind of either ineffective or probably sending the wrong message, or allowing the pro-abortionist to be able to capitalize off of it?
That's a great question. So again, a lot of people are doing this, but I think ideally a very concentrated movement to, number one, talk about the science. These are living human beings. They are distinct from their mother. They've got distinct genetics. Half the time they're a different sex, right? So talk about it as a human rights issue. We're ending human life, and 97% of the time we're doing it for social and financial reasons. Number two, this is not the solution to women's problems. Again, their problems are not, that the pregnancy is posing a risk to their life in almost every circumstance. It's these other things. It's the family breakdown, the fact that they're having sexual intercourse and men aren't willing to help them with the natural result of sexual intercourse, which is the conception of a child. So, showing what we do, showing how often we are the ones helping women through this, but also more broadly, bringing men into many of the pregnancy centers will do relationship counseling. They'll help that young man who is scared to death, who doesn't think, because he's never had a father in his life. He doesn't know how to be a father.
Right.
So male mentorship programs to help both of these young couple understand what it's like to be a mother, what it's like to be a father, encouraging marriage, on a governmental level. And I know that there is a lot of motivation in the current administration to have family-friendly policies that make it not a financial hit when you decide to have a child and take some time off from work, those type of things. So we're doing it, but just to maybe more broadly articulate what we're doing, how much we care for women. It's not just about the baby, it's about the woman too, but it's also about the breakdown of the family, because these women who carry their children and they're single moms, we all know the breakdown in society that occurs there. So a much broader conversation would be nice, maybe a little less nitpicking over the details, and just recognizing that although we have a political opportunity, it's not a political issue.
Yes. Yeah.
It's a moral issue. It's a human rights issue. It's a spiritual issue.
Yes.
And so engaging our churches and really talking about it from that perspective, I think would really help. Politically, we do what we can, but again, the Dobbs decision hasn't really resulted in a decrease in abortions. So that didn't turn out to be the solution, really.
No, I agree with you completely, and that's why I asked you that question: is are we chasing the wrong thing? Should we go after the bigger piece? Because again, when I go back to that Planned Parenthood website, every bit of it deals with sex. It's either preventing sex, what to do if you have a pregnancy, what not preventing sex, or like preventing pregnancies, what to do with it, dealing with the STDs, dealing with consequences of immoral sex. And so so it seems like they seem like to understand, and they just want to take the side of immorality, and that's why I asked that question. So I'm real glad to hear you say that and understand and appreciate where a lot of that comes into play. So if people want to know more, they want to know more about the Lozier Institute. They want to know more about what you're doing. I know you're on X too. So how do we find more about you? How do we find more about the Lozier Institute? How do we get involved in these in this conversation?
Yeah, thank you. So after 25 years in private practice, I retired from that job so I could work at Lozier Institute because I feel that there is such a need for good, high quality information drawn from the peer-reviewed literature, not just emotional discussion, but what does the science really say? So people can find things I've written at Lozier, Lozier Institute.org. My Twitter account is .docskop, DOCSKOP. And as far as getting involved, I think that people need to educate themselves so that they can explain to their friends, no, these are not needed to save women's lives, et cetera. But I think we need to be talking amongst ourselves within the church. We need to encourage
Yes.
our pastors not to think of it as a political issue that they're afraid of, but they need to recognize there's women and men sitting in their pews week after week with abortion on their conscience. And they need restitution. They need to know that it's okay to talk to their pastor or their priest about it and receive forgiveness. But yeah, I think if the church engaged, I really think we would be victorious. But that needs to happen.
Well, thank you so much. I greatly appreciate you. I greatly appreciate all that you're doing, and just fighting for what you're fighting for. I mean, it's absolutely incredible, and and I know that you take the hits on it, and so for the impact you don't realize that you make on some young child who's grown up, and you've taken the hits for that young child that you will never even see, it's absolutely incredible. So thank you so much for all that you're doing.
Oh, thanks. It's a blessing to be able to do this work. I'm happy.
Well, good. Thank you so much.